Good afternoon, everyone, and thank you for joining us today. My name is J.D. Fisher. I'm a payment model analyst with Healthier Washington here at the Healthcare Authority, and I'm pleased to be opening today's webinar on communicating about value to employees and lessons learned from rolling out the Accountable Care program. This webinar is a part of our ongoing series of webinars about the many aspects of our new value-based purchasing strategies. And today we hope to share with you about our experience over the past year and change as we've developed the marketing and communications plans for our 2016 Public Employee Benefits Program open enrollment. 2016 was a very unusual year in that we offered 3 new value-based plan options to our public employees. 2 of these were under the UMP Plus umbrella. Those were made up of 2 networks, the Puget Sound High Value Network and the University of Washington Medicine Accountable Care Network. And then the third plan was through Group Health, and it's called Sound Choice. And offering these new value-based options means not only that we need to educate our members about what value meant in that context, but how they could choose the right plan for them and their families. And that's what we hope to communicate a little bit about today. And we are pleased to be joined by some of our very important partners from both Group Health Cooperative and the University of Washington. From University of Washington, we'll have Karen Peck, the Associate Director of Strategic Communications, who has worked closely on the Accountable Care Network marketing communications since the program was launched. And from Group Health, we'll have Dr. Sarah Levy, the Medical Director for Continuum of Care, and Luann Wolf, the Director of Marketing for Member Engagement. And at the end of today's webinar, we'll have a session for questions and answers, and look forward to that discussion. And before we dive in, I want to just go over a few housekeeping things to make sure everyone in the audience is well connected and can hear. We have multiple options for audio. You can use either your mic and speakers or the telephone. We are accepting questions throughout the webinar through the chat panel, so please use the question pane during the webinar to submit questions, and we'll collect them and read them back at the end. And our slides will be available for download in the handout section of the screen and the Healthier Washington website. And just to make sure you can hear us, check to see if your speakers and headphones are turned on and plugged in, that your PC, if your PC is muted and the sound settings are correct. You can also go to the GoToWebinar sound setting panel and to gotowebinar.com for additional support. And with that, I'm going to hand it over to Amy.
Hey, thank you so much, JD, and hi everyone. Thanks for joining us today for this conversation. I'm Amy Blondin. I'm the Chief Communications Officer here at the Healthcare Authority. Today I'm going to start by talking about why we felt it was so important to engage our employees, in this case public employees, in choosing their healthcare plan. Then I'll give a little background into the population that we at the Healthcare Authority cover and why it gave us an opportunity for new engagement and messaging. Third, I'll walk through the strategies we used to engage members in choosing their healthcare plans during open enrollment and some of the lessons that we have learned. And then finally, we'll get to turning it over to our partners from 2 of our new value-based plans, UW Medicine and Group Health Sound Choice, to talk more about their strategies to attract members to their plans and their lessons learned. And then, as JD said, we'll leave plenty of time for questions at the end. So I want to start by talking a little bit about why we feel so strongly that employee engagement matters. We wanted to focus really intentionally on engaging employees in a conversation about value-based care and the new plan options. And by engaging, we mean not just offering information, but also opportunities for conversation and questions through benefit fairs and other venues. First, from a practical standpoint, we were changing our purchasing strategy and benefits, so employees needed to understand what the changes were, what value means, and why the new health plans might be a good option for them. We can offer all the plans we want, but people need information and a chance to ask questions if we're going to see enrollment in a value-based plan. Second, we have a philosophy that I know is shared by many of you, that engaged employees are healthier and feel like they have more control of their health. We know that employees that have good information and health literacy will make more informed decisions about their care and use their care wisely. And of course, we partner closely with the Washington Health Alliance on consumer education, including the Savvy Healthcare Shopper series on their website. We viewed the introduction of new value-based plans as a great opportunity for continued consumer education. So, introducing the new plans in 2016. HCA does not routinely add or remove health plans from our benefits offerings. So this was a pretty big deal for us. Driven by a legislative mandate and by our Healthier Washington work, HCA is changing the way we purchase care. So in 2016, we did add these 2 new value-based plan options to our members. Not only did our new purchasing strategy provide us the opportunity to increase the value-based plan options, but it provided us the opportunity to engage our members, as I mentioned before, and about what we are doing, why, and why it's important to them. So, HCA's engagement strategy in 5 not-so-easy steps. I'm going to walk you through our strategy for the new value-based plans. We started with focus groups to gather information that really informed all of our decisions about outreach and marketing. Then we defined our audiences. We created key messages, developed materials that stayed true to those messages, and then we evaluated the strategy and used the data to refine and improve our engagement in the following open enrollment cycle. So a little bit more detail on each of those steps. Before we invested much time in developing marketing materials, we needed to better understand what our members wanted to know about the new plan choices and how they wanted to hear it. We started with research. We did several focus groups in July of 2015. A real aha moment for us was that 2 of the main words we'd been using to describe the new plan, accountable and value, fell pretty flat with the focus group participants. It was jargon that really meant nothing to them. So clearly we needed to refine our messaging to resonate with what the members needed to know and wanted to know. Incidentally, in those focus groups, we tested several plan names for the new offering under Uniform Medical Plan, and they didn't love any of them. So we went back to the drawing board and quickly realized that we had the answer right in front of us. These plans were not meant to be a total departure from the UMP that many members already knew. They were meant to take what members liked about UMP and add to it. So hence the UMP Plus that we came up with for our 2 plans. Now that we had some information in hand from actual PEB program members, it was time to think more specifically about who we wanted to target. It was important for us to think through which PEB program members would be the most likely to fit well with value-based plans so that we could tailor our marketing appropriately. We worked with a really skilled marketing and branding agency and ended up with 5 segmented audiences to which we targeted our marketing. They're listed on the slide along with an example of how we thought about each segment. We also needed to be clear about which members were not a good fit for these new plans, and you'll see that listed on the slide too. The last thing we want was to oversell an option and the PEB member felt like they were not given all the facts they needed to make a wise decision. After we had thought through our audiences, it was time to create messages we believed would resonate with them. We built branding themes and an elevator pitch, then developed what we called bites, snacks, and meals. The bite is the hook, the high-level message we want our audiences to take away. The snack adds proof points to give people more substance and understanding, and the meal offers details, comparison charts, and restrictions. This level of information is often provided on our website or in member packets. Once we had our key messages in hand, it was time to develop materials. So I'll mention here that HCA is the marketer for both the PEB program overall and for the Uniform Medical Plan, whereas, of course, Group Health leads marketing for its plans with group health information also included in PEB program materials. So, given those 2 hats, we developed UMP Plus specific materials as well as overall health literacy materials about value-based care, which could be used for all PEB program members no matter which plan they chose. For UMP Plus, the materials we developed included web content, a mailer that we called the Kitchen Table Toolkit because we envisioned members sitting around their table talking through their plan options, and content for our regular newsletters and benefits fairs. For value-based purchasing overall, we created web content, a video, and a handout that gave members tips for what to think about when choosing a plan. So here are some examples of what I'm talking about. The video, web content, and the Shine a Light handout were used as consumer education tools, helping our members think about how to choose a plan. In the handout, we relied heavily on content from our partners at the Washington Health Alliance, who have great health literacy resources. So a little more than 10,000 PEB program members are now enrolled in a value-based plan. We surveyed PEB program members this summer to learn more about why they might have chosen the plan they did during open enrollment. You'll see that we had several key takeaways from the survey. In particular, we learned that members want even more detailed information about cost saving and benefits. Those were really important things to them that we needed to make sure that we focused on. With the survey feedback, we're refining our strategy for the upcoming open enrollment in November of this year to address both PEB program member needs and what we hear from other purchasers about what they need. We're producing a video that very clearly defines who UMP Plus works best for. We're gathering testimonials from real PEB program members about why value matters to them. And we're creating a purchaser toolkit to post on our website to help other purchasers around the state move to value. Much of the marketing work we did will be shared there for other purchasers to use, along with the other items that you see on this slide. So that, in a brief nutshell, is HCA's work on outreach and marketing of value-based plans. I'm going to turn it over now to UW Medicine's Karen Peck, who's going to talk more about their experience. Karen?
Thank you very much. I will probably have some control over the slides in a second, but in the meantime, I will introduce myself. Again, I'm Karen Peck. I'm with UW Medicine. I'm an Associate Director of Strategic Communications here, and I have been working on our UW Medicine Accountable Care Network team since the very beginning when we launched that. And so I'm going to tell you a little bit about how we did that, and then a little bit about how we have worked with HCA to engage public employees, many of whom are actually our own employees over the last open enrollment time. So I'm sure that most of you on the phone are probably familiar with the triple aim. This is basically the fundamental concept behind accountable care and certainly healthcare reform, and it's something that we've been working on for a very long time throughout the UW Medicine health system, and also have found it in a lot of the like-minded organizations when we set out to form an accountable care network. And really it boils down to three major areas: improving the patient experience of healthcare, obviously achieving better health over populations, so populations of diabetes or cardiac care or other larger population health issues. And also, of course, key is making healthcare more affordable. So the triple aim really was what drove us to create the UW Medicine Accountable Care Network. And we became an accountable care organization, UW Medicine did, in January 2014, and then proceeded to form our network pretty quickly after that. Our first partnership was with Boeing, and that was started in 2014, and then a year later we partnered with the Healthcare Authority in 2015 for the 2016 plan year. We use across our accountable care network something called a medical home model, and I could get into a lot of very specific details about this, but the medical home model really is about coordinating care around a patient, using primary care kind of as the center, but really understanding what needs are at the point of primary care. So building out a primary care medical home that includes things like mental health and nutrition and other things that we know from experience will help patients not develop, say, chronic conditions or treat chronic conditions, either preventing them or from getting worse. And the medical home model helps us do that. It also gives us a very strong starting point to help coordinate care with specialists when that's necessary. And again, if you look up medical home model, you'll probably be able to get a lot more detail about that. We set out to build probably the most comprehensive accountable care network in Washington because we knew that engaging people isn't just about the quality of care that you give, but it's also about giving them convenience and being able to give them care close to where they live or work. And so we did really set out to build that, that comprehensive network. You get an idea of how many specialists and hospitals, urgent cares, emergency departments we have in our network, and that is actually growing on a daily basis. We have practices and providers who are joining every day or asking to join every day. This will give you an idea of who our Accountable Care Network members are, and just to let you know, for the HCA product and for public employees, a couple of these folks are not currently in that network just because based on the counties that we currently serve. So while Peace Health and its hospitals and Island Hospital are both members of our overall Accountable Care Network, they're not currently today part of the HCA offering. We do expect in future years, as we expand the counties and areas that we serve, that those organizations may come in. And the other thing that you might see on here, Cascade Valley, which is up in the Skagit Valley area, has become part of Skagit Regional Health. So they will be really positioned to our public employees as part of Skagit Regional Health versus a separate entity, but will still be an active part of our network. So again, we probably don't need to spend too much time on this, but you'll see the range of hospitals and physician groups that, that we encompass. Importantly, we have the two major children's hospitals in our network in the state, as well as Seattle Cancer Care Alliance, which is the leading cancer organization. So we not only try to make sure that we had geographic breadth, but we also wanted to make sure that we had the depth of care that would fulfill public employee health needs. So getting into a little bit more about what we've done to engage employees, these are major aspects of our interaction with public employees, and we've learned a lot through these. One of the most powerful opportunities we've had is the schedule of benefits fairs that the Healthcare Authority schedules all across the region. And we have been involved in all of those, both from presenting to people who come, to talking one-on-one with folks who come to the table. And I think we were all surprised by how engaged employees were and how many questions and how many people came. We really thought that not a lot of people would come to the presentations, and maybe people would come and pick out a promotional item, but really we didn't expect a lot of people, and we were inundated and found that it was probably the best opportunity to help educate people and answer questions. Many, as you know, of UW Medicine's employees are public employees, and so they had a lot of questions based on their knowledge of healthcare already, which was challenging and really helpful too, to help us know what people wanted to know about. We also did a couple of webinars, much like this one. It helped us to reach people geographically, to give them an opportunity to log online, and we did it a couple of times, and then also produced a recorded version that people could access anytime, to give them some background about the UMP Plus UW Medicine Accountable Care Network option, what was included, a little bit about benefits and scope, things that we had learned that they really wanted to know, and got lots of great questions, and really learned that we need to market those webinars a little bit better. For those people who did attend, it was pretty important that they came, and I think that for those who didn't know about it, they were disappointed that they didn't. So we're going to do a little bit better job of getting out early behind those webinars and trying in as many channels as we possibly can to promote them so that people can attend. We also created a, actually also from the benefit fairs, we had several pieces of collateral that people picked up, fact sheets and brochures and flyers, and learned a lot by how people go to the health fairs and what they can use and what they can't use, what's really useful and what's not, and what's extraneous. And so we're doing a lot of refining of those collateral pieces to make sure that there's not too many of them, but that the pieces that we do provide at those benefit fairs really are what people want to know about instead of what we think they should know about. The portal that we created is probably the other tool that I think has been the most useful and the most powerful, especially during open enrollment, because we wanted to make sure that anything that we put on the portal really was helpful. We have a very extensive FAQ. We call out specific items that people want to know: who's new in the network, what new organizations, what new providers are new. So we flag materials that we know that they'll want, and that's really been learned over time in terms of feedback that we've gotten both from the Healthcare Authority and from people who have signed up for the UMP Plus option and have given us feedback on what they want in that portal. And then something that we did last year and that we also will end up doing this year as well is we will be sending out letters to folks who have signed up in the past, inviting them to continue with us and telling them that they are valuable and important. And then we also send out letters to what we call attributed patients. And these are patients who already get care, most of their care within one of the organizations in our network. And we think that these people can benefit by the cost savings and coordinated care of the Accountable Care Network. And so we're encouraging them to take a look at the Accountable Care Network since they already get a lot of their care through the ACN or through an ACN organization. And those have worked really well in our work with Boeing, and this is our first year being able to do that for the HCA population, and think that we can get a lot of folks to take a look at those things through those letters. Here's what we've sort of learned over time. We have done so much high-level thinking about accountable care and what we think people will want and why we think people will choose an accountable care network. And what we've learned, and we kind of laugh at ourselves sometimes, is we've taken ourselves very seriously. And what it comes down to is something that's not esoteric at all. For people who choose the accountable care network, saving money really is one of the very basic fundamental key drivers that make them choose this network, and really secondarily is their provider in our network. Those two, I would say 90% of the reasons people are choosing the UMP Plus Accountable Care Network options are those two things. Can I save money, and is my provider in the network? A couple of other things have really become important. We offer for HCA and public employees a virtual care clinic, 24-hour-a-day virtual care clinic that is free to them. And so for people who have small children, for people who don't feel like getting up in the middle of the night and going to an urgent care, this is something that has been a differentiator for them if they choose, because if you don't choose the UMP Plus model, you can still come to the virtual clinic, but it will cost you for each visit. And the centralized contact center. Most people want the convenience of that. They want to be able to make their appointments and ask their questions and find out if their provider is in the network all in one place and not have to go to a million different places. So that centralized contact center has been a very key satisfier for the people who've chosen UMP Plus. A couple of the things that I think that Amy touched on based on the Decitel Hagee marketing information is shared decision making, which we spent a whole heck of a lot of time explaining, just isn't all that important. People, I think, basically already expect that they will be able to share the decision making with their providers. I think that that's one thing that they already expect in their healthcare, and so using that to tell them what they're getting with UMP Plus just is not important to them. And then also, no one knows what accountable care means, and in fact, some of the feedback we've gotten, which we find really interesting, is accountable stresses people out. Actually, people who sign up for UMP Plus, UW Medicine Accountable Care Network, are stressed out about the word accountable because it sounds a lot like the success of their healthcare rests on them, and they're accountable for the success of their own healthcare, and it stresses them out. So things that we never expected, we've learned over time, and so we've been adjusting our messaging and adjusting a lot of how we talk about accountable care based on that feedback. People ask us sometimes how we measure success about our accountable care, and a lot of that has to do with patient satisfaction and how satisfied people are with the kinds of services they're getting, but also the improvement overall in health. So we are working with the Healthcare Authority over time to look at scores in these areas and how well public employees are satisfied with the services, and also how much improvement in their overall health we're seeing. And these are the areas where we really measure our success as an accountable care network organization. So I'm thinking, because I'm not able to move the slides forward, that this is where my slides end and where group health begins. And I'm happy to answer any questions at the end if you have them for us.
Hi, this is Luann Wolf, and I'm the Director of Marketing for Member Engagement at Group Health.
And I'm Dr. Sarah Levy. I'm one of the medical directors in the group practice. And I'm going to start off by talking a little bit about how value-based design strategies are hardwired in, kind of who we are, and what we do to execute on those strategies. Then I'm going to hand it over to Luann to talk a little bit about how do we communicate that with members. So many of you know that Group Health was founded by a group, really a community of like-minded physicians and consumers who came together to create the first integrated health system, hoping to provide comprehensive care and affordable coverage together as a package. So that was 1947, and really in the 70 years since, we've tried to remain true to that vision. So core to our being then and now, really foundational, is the practice of preventive medicine. We pay our doctors a salary not for the number of patients they see each day, but for providing care for that group of patients. So, because Group Health was founded by and for members, we're fundamentally about populations. We know who our patients are, and parenthetically, we know who the doctors are too. And doctors are free to take the long view to patient needs, treating people when they're ill, but more importantly, keeping them from getting sick in the first place. When care is needed, it's based on the latest, most reliable science available. I put in the slide about the chronic care model, even though it's a bit of a chestnut, because it does actually get to the value of engagement. So this picture was created in 1996 by Dr. Ed Wagner at the McCall Institute to describe what was then a new chronic care model. And while it does describe an approach to chronic illness management, it also addresses longitudinal care for populations that may not have an identified illness but do have health care needs. The description of this model grew out of some approaches to care that were already at that time common at Group Health: the use of registries for chronic illness, outreach to patients with care gaps. Actually, the concept of care gaps was kind of new at that point, and commitment to evidence-based medicine. Over time, the resources, technology, and the evidence have evolved. Medicine is changing daily. But what hasn't changed is that concept of community, health system, and medical practice inputs to the longitudinal care of engaged patients. And when we worked in the mid-2000s to develop a patient-centered medical home, it really grew out of this model. The medical home, as many of you know, is described as a rubric for providing care that's accessible, continuous, comprehensive, and coordinated. So how has that evolved today in terms of what we do? care is still evidence-based and comprehensive. It's now available through more channels than ever before. We're able to reach patients wherever they are, whether that's in our buildings, on our web portal, or on the phone. And technology allows us to address all of a patient's population health needs with every touch. So you can think about in reach. Every time we connect with a patient, regardless of the channel, we're offering all of the needed care, not just what they asked for. We also perform outreach. That might be in the form of birthday letters, targeted phone calls, secure messages to patients who haven't requested care. And the technology really supports that longitudinal care focused on outcomes. So that would be an electronic medical record integrated with a patient-facing web portal. I wrote a few examples and would add, just call the consulting nurse about a cold and you're likely to hear that you're overdue for a mammogram. Open your web portal to pay the bill and you're going to see if your diabetes lab studies are overdue. And generally speaking, care is driven by medical needs and may or may not be visit-based. A few other examples. We have a fabulous HIV provider team that works closely with a specialty medication pharmacy group and together are able to ensure nationally recognized adherence rates for HIV medications for patients who may not actually visit the office terribly often but stay up to date on medicines and labs. Primary care nurses are using chronic disease trackers within the electronic medical record to follow diabetic patients over time, coaching them to targets that the physician set in the care plan. Again, patient may or may not be present for that coaching. And we talked a little bit about the web portal as well. Luann, do you want to take over and talk a little bit about onboarding?
So as the new members join Group Health, this is really a critical time, and when they're purchasing their plan as well as when they take their first steps through our door. We've been doing a lot of tracking and to understand, both asking members what they need in their first 100 days, but also tracking behaviors to understand the types of information they need at what time and what's the best way to deliver that information. It can be a little overwhelming to start up at a new member in a new health system. So we're working really on this idea of pre-enrollment and post-enrollment messaging. What do they need to know before they start? What do they need to know early on? And doing some quick hits to really rapidly identify those targeted individuals that may need immediate care, somebody with a chronic condition or something with an upcoming procedure, to make sure that they're getting the care they need right away. So we're doing a lot of research to understand where the members are sitting in this first 100 days. It's really a critical time. The other thing we're doing is really, earlier it was mentioned that engaged members are healthier. We fully believe that here at Group Health. And not everyone engages or learns in the same way. So we're looking at a really diverse way of reaching out to our members. Some of it is really in a grassroots type of way. We're taking our providers and we're really putting them out in the field to the community. We've recently launched teddy bear clinics where we're taking teddy bears out to talk to young children to kind of get over that fear of doctors. We're doing that at community events. We're taking health literacy materials to farmers markets and handing them out on the back of recipes to talk about how to get care and things like flu shots. So we're tying kind of pieces that will help educate members to where they are in their life. We're not asking them to come to us, we're going to them. We're also building out content, a lot of digital content, stories that we can push out through our blog and our emails to members, as well as provide it out as almost a public service. And then for members that need to understand and use our plan, we have a really robust web portal with ability to contact their doctor and as mentioned earlier, to really understand what maybe they're missing a screening or something like that, as well as how-to videos on maybe some more complicated things to engage in. We've actually created a series of new videos, so members that learn that way versus reading would rather watch a video, so we're going to try to hit them from multiple different touch points. We have a new campaign launching this year in the next couple of months that we're really calling seasonal care options. And this is really kind of a specialized program for, we're going to call those non-engaged, non-utilizers. That may be because they just are healthy individuals and they don't necessarily need care. That's great. But they're not walking into our services every day, so we don't see them. Or maybe they have some kind of fear or phobia that keeps them away. But there will become a time, usually cold and flu season is a big driver, where they have to break down and actually get care. And we need to let them know what's out there for them. So we're creating a marketing campaign over the next couple of months that will continue throughout the year that ties really location-based marketing. So literally, what is within 10 miles of my house? What are my care options? And we're also using digital and social media to reach out to these members that don't engage with us to say, hey, did you know that there's a care clinic right around the corner if you're feeling poorly or your kid's up? We're also using this to promote virtual care, walk-in clinics, primary care, as well as engaging directly with their primary care providers. So this really is going after that audience that has always been hard to reach. And we don't want to reach them the day they end up in the ER. We want to get them into the care systems as early as possible. But these are a little bit sometimes the toughest nuts to crack. So with that, I'll turn it back over.
Great, thank you so much, and thanks to all our co-presenters. This was a great look into what HCA and our partners are doing to reach members and prospective members. So we've got a couple questions that have come in through the question pane, and I would encourage any audience members who have tuned in and have additional questions to please submit them. We're happy to answer them as time allows. So the first one that we got was, what is the status of your engagement with the Providence network of clinics and hospitals, specifically in the Thurston County area? And this is regarding our UMP Plus network. And thankfully, Michael Arnes, our account manager for the Accountable Care programs, has joined us, and I'll let him handle that one.
Thanks, JD. Unfortunately, we did not reach agreement with Providence Swedish centers, and we did, the Healthcare Authority did continue negotiating with Providence through the spring and the summer. We were hoping to reach an agreement for Thurston County and other counties in Washington, but we just could not come to terms on a lot of the other, on the accountable care concepts that we were able to with UW Medicine and Puget Sound High Value Network. At the same time, though, that we were negotiating with Providence, so we did negotiate to expand with both of our current partners. Again, Puget Sound and UW Medicine, and so we will be entering 4 new counties in 2017, and those are Grays Harbor, Skagit, Yakima, and Spokane. And so a lot of the materials that Amy Blondin was talking about that we're putting out during open enrollment will be highlighting those counties and what the people can expect for service in those 4 counties.
Thanks, Michael. And Michael, you were able to answer one of the other questions that came through, which was whether or not UMP Plus will be available in Grays Harbor in 2017, and that answer is yes. Both networks have expanded into Grays Harbor, so we're very excited about that. We got another question, and this sounds like it's a little more of a personal question coming from a PEB member who is considering the University of Washington Accountable Care Network. And they want to know, what's the best way to meet a provider without scheduling an appointment about a specific issue? So it sounds like they're looking to connect with a potential provider within the network. And the secondary question to that one is, will there be urgent care options opening up in Thurston County? So maybe Karen, you could handle that question.
Sure. We are looking to expand our urgent care network. We're opening up several new ones, and I can, while I'm not specifically sure about Thurston County, we are definitely looking at the north end counties to see where the best urgent care, we often co-locate them with our neighborhood clinics, but where those will be best situated. I think Skagit is one of the places that we're looking at right now. We have a neighborhood clinic that just recently opened there in Smoky Point, and we'll be looking to do some urgent care in that area. In terms of providers and meeting with providers, What I would suggest, there are so many of our providers who are definitely willing to either sit down with someone for an interview or a short consultation without having to make an appointment. I would definitely suggest calling our contact center, number one, to find a provider who probably best matches what that person's needs would be anywhere in the network. And number two, to be able to connect with those folks. They would be able to connect to a clinic or a provider without making an appointment. But they're really the kind of one-stop shop in terms of being able to find what somebody needs. And if you are on the phone, the number that I would suggest you call would be 1-855-520-9500. That's actually a special number that the contact center has created for UMP Plus members. But if you are actually considering the network, I would call that number and let them know that you're considering the network and see if they can answer a question and connect you with a provider.
All right, we've got another question coming in, and this one I think could be answered by any of our co-presenters, but there's been a lot of talk and a lot of work being done to advance shared decision-making tools to providers, and we're just curious about where that fits into some of these strategies of engaging members and advancing these new plans. So does anyone want to?
Yeah, I'll take a stab at that. At Group Health, we are asking all of our providers to do some shared decision-making training through the Foundation for Shared Decision-Making over the next year. A number of providers have already been trained. I found the UW learnings kind of interesting in the sense that you wonder whether we are more interested in engagement than our customers are. Nonetheless, I think we believe that fully informed patients make better decisions for themselves and ultimately decisions that lead to better quality outcomes, and that shared decision-making is a skill set for providers to understand patient-customer values before helping them to reach decisions that will work for them.
And I'll just add, from UW Medicine Accountable Care, we actually have undertaken quite a bit of internal training to help our clinicians and our regular staff understand what accountable care is, what the Accountable Care Network is, and we have a variety of transformation of care initiatives that actually really focus on that shared decision-making and coordinated care. I think if you were to say shared decision-making to a public employee, or to say that that was a benefit, that might leave them cold, but they feel it when it happens. So even though we may not use the language, the actual actions we know are important, and so that is what we train on.
Great, thank you. I've got another question, and this one relates to some of the marketing and advertising work and promotional work. Does social media like Facebook and Twitter really work for reaching people about choosing a plan and educating them about the plan specifics?
This is Karen from UW Medicine. It does, except the messaging has to be very general. What we've learned is people have pretty specific questions when they're choosing a plan. So I don't think you should ever leave social media out of the mix, and particularly when you're following up with people who have signed up. But we have learned that the messaging has to be fairly generic, or you just can't get as specific as you'd like about specifically choosing a plan, because people have different reasons.
And this is At Group Health, we use social media extensively to talk to both existing members and potential members, and we do a lot of targeting geographically based on behavior types to really reach out to people that would be most likely to consider with messages that hopefully resonate. We also look at things, the upcoming care information we have is using a kind of beyond social and really doing a digital targeting. So social media in terms of Facebook is good for branding, but we get a little bit more specific out there once we have identified a target audience. We also look at things like Snapchat and Instagram as a way to really reach out to that millennial population and even younger that are starting to make those decisions.
Wonderful. Thank you, Bob, for responding to that. It's very fascinating with this whole world of social media. So another question, and this one's a little more specific to the accountable care plans and their networks. But what improvements do the networks have on the horizon to improve the delivery of care? And how are you planning to promote that to your members and prospective members?
This is Karen from UW Medicine Accountable Care Network. What we do every day in our transformation of care initiatives, that's our whole driving force behind improving healthcare and improving service, and the quality of our care is what people come to us for. And so we understand, we listen very closely to them, and I think that the feedback that we get through both general surveys and also the surveys through HCA is really important to us. It's hard to pinpoint one specific thing, but we're always improving that care for Accountable Care Network and listening to what people need. I'd be curious to see if there was something more specific in that question that the question asker would want to know.
All right, we'll let you know if anything else comes through to clarify that. Another question, and this one relates to some of the discussion around the cost and the perception of cost to members. What types of cost messages or comparisons seem to resonate with members and prospective members?
Well, I think, okay, go ahead, I'm sorry.
This is Amy from HCA. I will say that for our PEP program overall, our members really want specifics, and they want it laid out in a chart or a table that shows them everything across the board. I mean, they don't want to have to do any major math or calculations to figure out what the best value is for them. So we really try to just lay it all out there and let them do the thinking and the talking with their families about the best option for them. So I think more information, the better about that, and the more specific, the better.
Did you have anything to add to that? I didn't catch who was speaking, but please feel free to add to that.
This is Fred Armstrong at Group Health. I will add to that. There are layers of cost that are in a benefit program. Probably the most important one is the one that employees see every paycheck in terms of their premium contribution. And a lot of people make decisions based upon what is the premium cost share. Once you are accessing care, then there are member cost shares at the point of service, whether that's a deductible or a co-insurance or a copay. And members that are higher utilizers of healthcare services probably are more in tune with those. But you have to structure your communication to be addressing all audiences.
Great. Well, it seems like we've reached the end of the inflow of questions. So I just want to reiterate my thanks to our co-panelists from University of Washington and Group Health, and to Amy, and to everyone who participated in joining this webinar. And look forward to next month's webinar. We should have some more information coming out shortly to detail what that webinar will cover in this continuing series. So thank you and stay tuned.